Back pain can be very debilitating for many people. And because back pain is so common, sometimes it can just feel overwhelming that you can't stay active, you can't sit, stand. The things that you normally love to do are not fun. And so it may feel like you want to rush off to the doctor, get some testing done, and find out what's wrong. But do you actually need an X-ray or MRI? That's what I'm going to talk about today in this video. So 98% of people can actually resolve their back pain with conservative treatment, like some exercise, massage, things that are going to help calm it down and really make some lifestyle changes. But for some people, that back pain can be really debilitating and it can be scary. So how do you know if you truly need to go off to the doctor and get more testing? Well, I would say there's top 3 things that are really red flags and things that if someone came to us and told us they were having these symptoms, we would tell them to go right to the emergency room, go see a doctor. So if you're having weakness in the legs, it's very hard for you to stand or walk and your legs feel weak. Number 2, you're having any numbness in the saddle area, that area between your legs, or you're having changes in bowel or bladder function. Those are 3 big red flags that you definitely want to go see someone. So don't watch this video, move on, go see a doctor if that's what you're dealing with right now. Now, I want to talk about other reasons why you may have back pain and just explain a little bit more so you can understand truly what's going on and when it might require an X-ray or MRI. Now, I'm going to show you a lovely spine model here. And as you can see, this is looking at your back from behind. So you have these spinous processes, these parts that kind of stick out there in your back. And from the front, you can see that each vertebrae is a piece of bone there where you have discs that are in between. So when you talk about a herniated disc, some people refer to it as a slip disc or a disc problem. Those are your discs in between your vertebrae and in between your spine. Now, from here, because your spinal cord goes through that area in your spine, you have nerve roots that come out from your spinal cord at each level between those joints. So the back pain that you're having can be confusing, and it's important to understand a little bit about the anatomy when I discuss the types of back pain and what can really be the culprit here. So back pain can come on with a traumatic fall. You have something forceful happen. Now, in that respect, that can result in a reason why you want to get some testing done, go see the doctor, because with any kind of trauma, you may have compressed that vertebrae, cause some type of fracture, and that's something we definitely want to make sure that you get checked out for first before you were to see someone like us, a physical therapist. Now, that pain, if it's debilitating where you can barely walk, stand, you can barely move, and you can't get in a position of comfort, then an X-ray is probably going to be your best option there first. Now, what is the difference between an X-ray and an MRI? Well, an X-ray is going to show bone. So things like a fracture, a compression fracture, or a fracture off bony fragments along the side with a fall or a car accident, something pretty traumatic. And especially with aging, if you have a diagnosis of osteopenia or osteoporosis, fractures of the spine can be more common. So that is something that an X-ray is going to show. It is not going to show soft tissue, but it may show some effusion or swelling around certain areas that you're dealing with the pain. Now, an MRI is truly going to show more of the soft tissue. So discs, ligaments, muscles, any of the soft tissue structures is going to be a little more thorough. And if someone is dealing with a disc problem, the reasoning why we may suggest getting an MRI is truly if you think you're going to have an injection, you're going to go down the road of surgery. Those are the reasons why a doctor would truly want to see where the pain is coming from. Now, that is the difference between the X-ray and MRI. There are a lot of different reasons why your back might hurt. And if this is something that's developed over time, it's not a trauma, not something quick that has happened to you, but it's developed over time, it may be due to posture or repetitive action, repetitive motion. Sometimes when you're having to do a lot of manual labor, or maybe you spent the whole week doing painting or gardening, something out of the ordinary, and your back starts to hurt. Well, most likely that's a muscular problem that gets sore. It's a ligament or muscle issue that can be solved with some rest, some guidance from someone like myself, a physical therapist that specializes in back pain and can teach you the more conservative ways to alleviate it. Now, if you still have this pain that's come on over a period of 10 days and it's not getting better, and this sounds more like you where it came on gradually, or maybe it was even sudden, but it can be something that was leading up to it for many years. Now, postural stress can do that for people. So with things like that, 98% of the time, like I said before, your symptoms can be solved with some conservative approaches. So I'm going to go through some different issues of why your back might be hurting. So like I mentioned, the muscle or ligament strain, if you have done something repetitive over time, or maybe you picked up something and your back starts to ache and hurt, or maybe you did a hard workout. A muscle or strain is going to usually feel uncomfortable if you try to bend forward and you're really trying to stretch that. So just like any sort of strain, muscle strain or ligament strain in your body, when you're stressing it and you're moving and stretching it, it's going to get irritated and aggravated. So the best thing to do is consult with a physical therapist. It's been 10 days, it's still kind of achy, it's gradually getting better, but you're just not 100%. Then there are some simple exercises, and you might need some hands-on soft tissue work to really relax the muscles around there to start eliminating some of the pain and guide you toward the best types of movements. Now, a disc issue, many people have heard of a herniated disc, but this a lot of times is not something that comes on suddenly, but gradually happens over time. And those discs in between your vertebrae, they're made up of water and they start to dry out after the age of 35. So it can be very common to get a disc issue in your 20s or 30s if you've maybe bent forward a lot, you did a lot of harm on your back where you were lifting heavy things over and over, or lifting and twisting. Now, a disc issue can be excruciatingly painful for some people. They may feel numbness or tingling down one leg where that nerve root is not getting enough blood supply, where the disc has either bulged into that canal or herniated. Now, a disc issue can heal itself over time. It doesn't always require surgery, and it doesn't always require injections. There are a lot of people that get relief, but it does take time, patience, and consistency in order to alleviate your symptoms. Now, seeing a physical therapist that's going to be able to guide you in the right direction with a disc injury, you're truly not going to know if you have that until you get assessed for it. But many times forward flexion type of movements can make your symptoms worse. And you usually can get into a position of comfort, sometimes lying on your stomach, or sometimes just in a position that's giving more blood flow and circulation to that nerve that's being pinched there. A disc issue too can flare up on and off over the years. So it's not always necessary to get an MRI or an X-ray for that. But like I said, if you were gonna go down the route of seeing a surgeon or getting an injection, they probably would do an MRI first to find out where that issue is coming from. Working with someone like us for a disc issue, we would do our tests to really fine tune and work on the muscles and the getting more blood flow, circulation to that area to help it heal, and also teach you the things that you can do in your routine throughout your day to prevent it from flaring up on you, to alleviate your pain and calm it down, plus teach you those restorative exercises that are going to help keep it away and allow it to heal too. Now, the next one that might be the reason why your back hurts and why you think you might need an X-ray or MRI is instability. So if you feel like you can't sit still, you're wanting to move and shift in your chair all the time, you feel like you can't sit at your desk for more than 10 minutes because you always have to move around, your back gets uncomfortable or achy. And for many people, when they wake up in the morning, they're getting a lot of that stiffness. As they start to move, their symptoms get alleviated too. That may mean you have some instability in your spine. We need to work on strength, endurance, postural muscle control. Pilates works great for that for the clients that we see, but does not require an X-ray or MRI because most likely that can be helped with conservative treatment. And the last one that I'm going to discuss that's very common is stenosis or having arthritis. Maybe a doctor told you in the past you have degenerative disc disease or degenerative joint disease in your spine, and that's when you start getting some of the narrowing there, the cartilage and the disc space gets less and less, and those joints get closer together and start irritating the nerve roots there. Now, stenosis happens as we age, and usually flexing forward or walking up a hill, so you kind of have to flex forward a little bit, is going to alleviate some of that pain and discomfort. This happens normally as we age, and it's very common to compare if you get an X-ray and you're a 6-year-old woman and somebody else is a 6-year-old woman and they get an X-ray. One person may have pain and the other person may not, and they could have very similar test results. Their X-ray or MRI might look similar. So it's very much going to be dependent on the person, but you can't always go off of what those tests show and what is in the X-ray or MRI report. So it's very important to know how your body is moving and also what your goals are, what your habits are like, what you're doing throughout the day, and what your exercise routine looks like. So stenosis or arthritis, you may want to get an X-ray and just for your own peace of mind and kind of see where the issue is. But if we were to treat you, we would do it based on movement and based on your goals and your limitations to get you more mobile, get you stronger, and help in the areas to really get back to the goals of the activities that you want to do. So it's not always necessary to get that X-ray or MRI if you're dealing with some of those issues, but you may not know you have stenosis or arthritis until you get an X-ray or MRI. Now, I hope that helps. Did you learn something from this video? I think for many people, they think right away they need to go see a doctor for back pain, but it's so helpful to get a conservative approach by someone that is a back pain specialist, physical therapist that can coach you and guide you toward a long-term relief of your symptoms with teaching you the right exercises and a daily routine to follow. And as we age, it is normal for your back to start breaking down, getting some aches and pains here and there, but you don't have to live like that. There's a lot of things that you can do to help solve it. So I hope you learned something from this video. If you have more questions about X-ray, MRI, what the difference is, or if your back pain is bothering you and you need a solution, go check out the other videos that we have on this channel with Pilates exercises and other reasons why your back might be hurting. So subscribe to Level 4 Women's Health. Thank you so much for watching, and we hope to see you soon.